Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to our development dialogue today. And inshallah, we'll be speaking to two prominent individuals who are very committed for the realization and achievement of a very ambitious Sustainable Developmental Goal, SDG, which inshallah by the end of this month, that is September, there will be a summit in New York where all the governments of 194 governments which are linked with the United Nations and member states, they will debate and agree the 17 Sustainable Development Goals. Very ambitious, first of its kind in the human history. So I see these two activists with us. One is Reverend Adam Taylor, works for World Bank, and he's the lead of the Faith Initiative. Welcome, Adam.
Thank you.
And we have Saif Smith, who is a senior advisor in the UNAIDS and also linked with the faith issues. Welcome, Saif.
Thank you.
Before I go further, Reverend Adam Taylor, it's a mismatch. You are a clergyman and you are working in the World Bank. What are the link? Can you tell us a bit about yourself?
Sure. Thank you. I recognize that it can be kind of an anomaly that I'm working at the World Bank, but I see it as actually a very good fit, in part because the bank has had its dream of a world free of poverty really since its beginning. And from my faith perspective, and this is true of almost every faith tradition in the world, there's a very strong commitment to care for the vulnerable, to protect the vulnerable, and to address poverty in its various forms. And so much of what has inspired me in my life's work, my vocational work, has been this faith-inspired call to address poverty. For me, it very much stemmed from some of the unfinished business of the civil rights movement. I grew up kind of in the shadow of that movement in the United States.
Oh, really?
Yes, and that movement inspired me a great deal. And if you look at what Dr. Martin Luther King and other leaders were pointing to, it was certainly about civil rights in the United States, but it was more broadly about human rights all across the world and economic opportunity all across the world. And so I actually had an opportunity to work with the current president of the World Bank, Dr. Jim Kim, during his leadership of the World Health Organization, and Sally has got some history there too, but he was a real leader and activist in the HIV and AIDS movement, coming from a kind of physician perspective. And through that connection, was very pleased when President Obama nominated him to become the president of the World Bank. And he has brought a real commitment and passion for strengthening social movements and working with religious organizations as really essential partners in the fight against poverty. So I get a chance to work toward that end.
Excellent. Well done. So you have reassured me that you are committed for the same thing where you were ordained to take care of the people and connecting them with the World Bank and securing World Bank resources to help out the poor and the needy, not the other way around. Am I correct?
That is true. I mean, the World Bank, its primary relationships are with governments all
Yes.
around the world. Our shareholders are governments, our clients are governments. But we recognize that we have to find ways to build new and creative partnerships with other key stakeholders. And faith-based organizations, religious organizations are key constituency and are a major part of civil society. So
Excellent, yeah.
that's a big commitment.
Thank you, Adam. Saleh, you are UNAIDS and you want to talk about health. Why are you interested in health? Tell me about yourself, your background.
Well, first of all, I started off life as a nurse, community health nurse, working in the hills of Nepal. I spent 15 years in Nepal, working for a faith-based
You're
organization.
working in Nepal now?
I was for 15 years.
No, we Al-Khair Foundation.
Okay,
We have
that's great.
have an emergency rehabilitation program now.
Excellent.
Carry on.
So, well, I was working similarly for a faith-based organisation in Nepal and working in a hill hospital with a community health programme that was about 8 hours walk from the nearest road, up where the epicentre of the recent earthquake has been, and really providing mother and child health services up there. And that was before the HIV epidemic was public, before it was well known. And it was very clear that we had a lot of problems with sexual and reproductive health amongst women, a lot of infertility and many problems in childbirth. And so then when HIV came in, then it was even more difficult. And it became very clear that in order to address HIV or sexual and reproductive health problems, you couldn't just have a biomedical approach. it was no good just providing hospital-based services. These communities had cultures, they had traditions, they had religions, they had beliefs. And in order to make changes in the way, in maternal deaths, in child deaths, and in the way some of the practices were taking place, you had to work with the local culture. So that was my introduction to working with faith, with culture, with women and children, and trying to increase maternal life, increase living children, produce healthy children, and later on then to prevent the transmission of HIV.
So how did you end up in UNAIDS?
Well, my husband was a tuberculosis specialist and we were there together. He was transferred to Geneva to work with the World Health Organization as a tuberculosis specialist, and then when we came to Geneva, then I worked with UNAIDS and was working in the Community Mobilization team, and then took the role of working as the advisor for faith.
Excellent. So you're based in Geneva?
Based in Geneva. Yeah.
Excellent, excellent. So both of you are very committed on the Sustainable Development Goal. So for the first one, I asked Reverend Adam Taylor, end poverty in all its form and shape, all its dimension. Such a bold statement. Do you subscribe to it?
I do, although I should clarify that the Sustainable Development Goals, which as you said, will be agreed to by member states at the end of September, has set a goal for the world of ending extreme poverty by the year 2030, so within a generation's time, 15 years. And we have this specificity around extreme poverty because we're really trying to focus on the most abject forms of poverty in the world, where people so often can't meet their basic needs. And so the world's definition for that is people living under $1.25 a day, which is a very low level of income. And we recognize that that measurement alone doesn't capture everything that we're trying to achieve in terms of human well-being and human dignity, but it's a really critical proxy for achieving those things. And for the bank, we recognize that there has been incredible progress made over the last 20, 25 years. 1 billion people have been lifted out of extreme poverty, have been lifted above that line, but there are still 1 billion people, or nearly 1 billion people, that are still living below that line, which is alarming and shocking. And we believe that the world has the knowledge, the resources to essentially eradicate extreme poverty, exactly. What's required is the political and social will, new forms of partnerships, and everyone playing a leadership role, including the faith community, but also the World Bank. So we're really anxious to partner where we can to achieve that common goal.
Which SDG, is Sustainable Development Goals, do you think is the most critical one for tackling poverty? Which one is the most critical?
I feel like that's a trick question because the SDGs are built in a way to be much more integrated and recognize that the goals themselves are indivisible. So, I could make an argument that health is really crucial. I can make an argument that education is really crucial.
Human rights, freedom of speech.
Governance issues, rule of law are being included in the agenda for the first time. Compared to the Millennium Development Goals, which were much more siloed, they kind of had 8 goals that stood on by themselves. The SDGs, again, are just much more integrated, and it includes a very strong commitment to sustainability as well as to social inclusion. And so, I think all the goals are crucial, and it also is so contextual. It depends on the country. So for some, education may be the most acute crisis. For others, what was really needed is huge investments in infrastructure and access to energy, or, so it varies by country as well.
Yes. Sally, I just wanted to say that by the time we have begun the discussion show, at least 20 children has already passed away, died due to waterborne diseases. In 20 seconds, one individual died, a child. What can be done? Where are we? Why the world is silent?
I think that's what the Sustainable Development Goals is about, isn't it? It's about the member states coming together to make these commitments to really make a difference. And as Adam said, it's about working across the sectors. We've learned in the HIV response that you can't just tackle one thing alone, because so many of these things are interconnected. We know that in 2013 we had 2.1 million new HIV infections. We had 1.5 million deaths. And in order to end the AIDS epidemic as a public health threat by 2030, we need to scale up to have 90% of people living with HIV knowing their own status, 90% of them on treatment, and 90% of those on treatment with a suppressed viral load. In order to do that, a simple biomedical response where you work with a hospital, perhaps that's run by the government, isn't going to reach all those issues and those social determinants that drive the epidemic and that leave people vulnerable and marginalised and left out of a national response. So I think one of the things we've learned in HIV is that you have to work with the nation, and the nation is broader than the government.
Yeah, of course.
The nation includes the people. It's the women's movement, it's the people living with HIV movements, it's the youth movement, it's the faith, it's the culture, it's the traditional beliefs and practices. And some of those are very positive. And so we need to learn from the positive traditional cultural practices and build on those. So if you have some practices around celebrating birth, then you can build on those practices. And an Islamic community, for example, can have a drive for celebrating birth in that community and encourage all new mothers to go to the hospital and have the test for HIV. They can encourage the fathers to go along with them. They can then provide packages of clothing for the family when the child is born and encourage new life and new birth. And at the same time, they can preach about the importance of eliminating stigma and discrimination towards people living with HIV.
Yes, I think it's breaking down the taboo in many cultures, because HIV/AIDS does not mean that individual is condemned to death or it is a crime they have entered into. So I think that's a big struggle, and I think involving the faith institutions to breaking the taboo is very important. So what are the mechanisms of engaging the faith from your experience?
From our experience, it's great to work with faith communities across all the different faiths. You can work with the individual faiths, and each of those faiths can then design an approach to address HIV that works within their own faith community. But at the same time, you can also work across the faiths, and you can learn lessons from one faith community to another. I think the best example of that recently was in Ebola. And I was seconded to WHO to help them with their Ebola response and to help them to look at how to include the religious communities in addressing that issue. And it was building on the lessons we'd learned from the HIV response that you need to work with religious communities in order to gain the confidence of the people to change some beliefs or practices that were providing a risk or putting people at risk of infection. So we reached out to some of the Islamic leaders, some of the Christian leaders, and worked with the scientists in WHO to rewrite their burial protocol. And in that way, the religious leaders were able to say, we don't want our people to die. If this is the way that we do a burial normally and this is dangerous, then we can change it in this way. We can adapt it in that way. And by listening and enabling then the religious leaders to understand what the particular medical danger was, they came up with the alternatives. But then they can roll it out through their communities. And the
Which
communities
will be much more acceptable.
are then welcoming that message. As opposed to sometimes when medical professionals come and they're giving messages to communities and people are afraid, they don't understand. But when they have the religious leaders come alongside and say, we accept this message, this is important, we need to do this for our health. So I think there's some really good examples of how you can work both across the faiths and then within faith traditions.
Yes, yes. Excellent experiment. Adam, I just wanted to see the devil's advocate saying, why does the world need SDGs? And what are they? I mean, if I want to ask you a naive question, why the world needs SDG? Yeah. And what are they? Who are this? What is this? You said integrated, coordinated effort and so on. Why? Why the world needs it suddenly?
It's a fair question. I think the world needs the SDGs because we need a unifying vision, something that can unite the world around a shared set of goals. The SDGs build on and learn from some of the experiences with the Millennium Development Goals, which were agreed to in the year 2000, were launched with the Millennium Declaration, and set 8 goals, one of which included cutting in half the number of people living in extreme poverty over those 15 years. The challenge was that the MDGs didn't include a very robust consultation process across the world. They built on previous commitments that had been made within the UN system, but they were ultimately agreed to pretty much behind closed doors with a very small group of experts. The SDGs have been created in a very different process. There was a major survey led by the UN that interviewed or surveyed 8 million people to try to understand what were their hopes and dreams, what are the most important issues to them in the context of the world they want to live in. And the results of that survey were then shared with world leaders as governments were developing these new set of goals. The other reason why developing a set of new goals is so important is because live in a very different world. We now are facing much more dangers and consequences from climate change than we knew about or we'd experienced 15 years ago. We increasingly have recognized just how crucial investments in education and healthcare can contribute to spurring economic growth and reducing poverty in countries. So we have a lot more evidence now than we did before. And I think what the SDGs do is they provide a common framework of commitment by the world to say we're going to work together to achieve these common goals. And countries may be at different places in the trajectory of development, but they're all facing some of these challenges. This is actually one other thing to emphasize is the Sustainable Development Goals are going to be universal in their application. It's no longer just about low-income countries or middle-income countries. This is about every country in the world. So even where I live in the United States or here in the UK, those governments are going to have to figure out how to apply the SDGs to their own context and make their own commitments in relation to them.
Yes, it's plausible that now the government is subscribed to it. Then it requires the entire, as you're saying, the nation is bigger than the government itself to buying in. So the United Nations now has started to consult faith organizations. There has been consultation before, but such a robust approach this time seems there is a greater awareness within the UN system. What is your thinking, Sally? Do you think it is an uphill task for the UN really to opening up with the faith organizations and engaging them really?
I think we have a good history. Again, I just want to pick up on what you were saying to the question to Adam partly about the SDGs. Do we need them? Because I think one of the evidences from the MDGs is recently we've seen the success of putting 15 million people on HIV treatment by the year 2015, and UNAIDS announced that success this week. And it was because we had an MDG that actually said we want to end the AIDS epidemic as a public health threat that we were able to do that. We go back to the work of the World Health Organization and UNAIDS a number of years ago, 3 by 5, put 3 million people on antiretroviral treatment by the year 2005. And at that time, people said it wasn't possible. But now we have 15 million people.
15 million have done that.
And I think it's setting those goals gives that energy for the advocacy, and it gives the energy to set targets. And then the targets mean that the programmatic activity follows and the funding flows that. And what we measure, what we set targets around and what we measure gets done and gets funded. And I think then that's important then when you come to see how you work with a broad set of actors around achieving that. Because we do have a history. The UN has worked with the faith community for decades. Faith communities were a part of the Declaration of Human Rights many years ago. The faith community were there with WHO at Alma-Ata, declaring the importance of public health for all.
Kazakhstan, yeah.
And again, I think we forget that at times, and we don't always stay too close together. But I think one of the things we've seen is that the evidence of the HIV response and the way the faith community has responded to that challenge has really opened the eyes again of those in the health and development sector to the importance of faith. And the importance of the faith response, both, as I said, in terms of the grassroots mobilization through the many mosques and churches and temples and faith communities, but also the vast networks of healthcare service providers. And we know that many of the health services in many countries are run by faith-based organizations, and they provide excellent quality of care. And I think from UNAIDS' perspective, we also find a very good avenue of conversation between the medical professionals within that faith community who are operating the services and the leadership of the faith community. And sometimes, if we're honest, we don't always agree about everything. And I think we have to be honest in the AIDS response, because there are some very difficult questions that we have to grapple with around criminalization. In a country where HIV transmission is criminalized, then a mother who doesn't take up the test for HIV in pregnancy and gives birth to a child who's HIV positive could theoretically be criminally prosecuted. And yet, in a culture where her husband must give permission for her to go and take a test, in a culture where sometimes the religion or the application of that religion means that she doesn't have the freedom to do that, then she doesn't have control over that, and yet is criminalized. And so I think some of those complex intersections between the faith leaders, the state and the laws, and then the actual outworking of that in the lives of people, those are very difficult conversations. And I think we would like to have more of those conversations, because we start with the same goal in mind, to save lives.
Absolutely.
And to actually think about some of the things we're doing that may be having the opposite effect to the ones we're expecting, and to ask some of those hard questions are really important.
Thank you, Sally. Thank you, Adam. I think you touched the final comment of yours is that save a life. I think in accordance to Islamic scripture, saving a life is saving the entire humanity. So with that note, I think, brothers and sisters, we have had Adam and Sally. Thank you for your contribution, and I'm sure the audience would have enjoyed the conversation and look forward to seeing you again. I conclude now. Assalamu alaikum wa rahmatullahi wa barakatuh.